Go for it.
Okay, instructions. Ready? Take it out. Everything you need to know is on this sheet of paper. And you get this copy to take home with you, okay? So bottom line is you are going to be groggy today. Anesthesia stays with you up to 24 hours. So go home and rest. When you have to get up to go to the bathroom, give them a heads up. Let them know you're going in there. You don't want to be in there and all of a sudden feel really woozy or lightheaded and he's thinking you're in bed sound asleep. Okay? It's normal to feel drowsy and weak, so just take your time when you get up and move around. All right, we've got a prescription for you. It's called Nucynta. Nucynta is a fairly new narcotic, and being that it's new, it has no generic form. So I'm going to give you this prescription as well as a card that's going to help lower your copay.
Okay.
All right? Works well for orthopedic pain. Always put something in your stomach when you take these. You can have one or two. So you may want to start with one. You can always add the second one. You just don't want to take too much to where you're completely out of it. Okay? Speaking of prescriptions, we have a prescription that says may return to work Monday 4/16/12.
Thank you.
Now you also have a pain pump. And I showed her, it's like a little grenade. It's sitting in a fanny pack.
Okay.
It's
And
attached
it's
to my sling.
basically attached to her sling, and it's also wrapped around her neck so that if it comes off of the sling, it doesn't fall to the floor. It's a very thin wire, just slightly bigger than dental floss, that goes right into the capsule of your shoulder, and it's dripping numbing medicine. So ultimately, it's kind of coating the surface inside there. Does it take away the pain completely? No. Are you still going to need the pain pills once the block wears off? Yes. There's about 24 hours worth of medicine in that little pain pump. Nothing you need to do with it, but leave it be. After 24 hours, so tomorrow late afternoon or evening, you can go ahead and pull that out.
Okay.
Sometimes you have to pull one piece of tape off the top part of your dressing because it's kind of secured that way. Just find where it goes in and pull it straight out in the same direction it appears to go in.
Okay.
If you can't pull it out, it's stuck, it's caught. There's so much tape that you can't seem to find where it starts or where it ends. Sunday is the day you get to take the whole dressing off and shower.
Yes.
So if you can't get it out tomorrow afternoon, worst case, you just leave it in until Sunday when the whole thing comes off.
Okay.
Most people work very hard to get that out, though, because it's one less thing you have connected to you. But don't panic if you can't.
Okay.
And don't panic if you're getting out of the car today and you accidentally pull it out. I mean, if you pull it out, it's done. You just don't have it in anymore. Don't panic. Okay? But that's sometimes a little bit annoying because you have to keep track of it. That's why we keep it close to the sling.
Okay.
All right? If you have any questions or problems, you got a card here with the pain pump representative's number.
Okay.
Okay? Or if you're trying to pull it out tomorrow and something's not quite right, don't hesitate to call. Okay? So I'm going to give you all these. Now, we talked about your medication. With this block, most people find they're very comfortable through the afternoon into the evening. Everyone's different as to how quickly it wears off. What I tell people is you can start your pain pills as soon as you feel you need to. There's no right or wrong time. However, if tonight, 10 o'clock at night, you're still pretty numb, haven't needed any pain pills all day, but you're going to bed for the night, take one. Because about 2 in the morning, that block's going to wear off, and you're going to be glad you have something in your system. Okay? So, for the next 3 days, ice and elevation is key. That's a reusable ice pack. You just unclamp it, dump out the water, put fresh ice in, reclamp it. After about 24 hours, if it's soggy, draining, throw it away. Baggies full of ice, frozen corn, frozen peas, it's all good. You can't feel the ice right now because everything's numb. Leave it on there as much as possible when you're resting because it has to get through the dressing and everything else. After the 3rd day, when you take the dressing off, if you're still liking the feel of the ice on your shoulder, that's fine. But then you only want to leave it on about 20 or 30 minutes at a time so it doesn't burn your tissue. So ice and elevation. Do you have to sleep sitting up? No. But are you going to be more comfortable in bed propped up on 3 pillows? Probably.
Oh, they told me to sleep in a chair.
Okay. Fine.
Okay.
You know, but if you want to be in your bed, they want you propped up at least 45-degree angle.
Okay.
Most people are more comfortable not laying flat. Okay? So ice and elevation, again, starting tomorrow, you can take your arm out of the sling and you can be only doing passive range of motion.
Yeah, the machine comes tomorrow morning.
Correct. So tomorrow morning, you may want to take the sling out and start doing pendulum exercises. And on your paperwork, there's a cute little picture of a little man doing pendulum exercises. You just go to your counter or your table, you lean forward, and you let gravity naturally help you move your arm.
For how long?
Little circles. You do it about 5 times a day for about 5 to 10 minutes at a time. Very gentle circles back and forth, slightly swinging back and forth. You're not really using your muscles to actively move the shoulder. Same with the motion machine. That's doing the motion for you. You're not actively doing it. It's passive, okay? So you can start that tomorrow as well. I would take your pain pills before you go in the motion machine for the first time. All right? But no active range of motion.
Okay.
Okay? Now it is important to move your fingers, your wrist, and when you're out of the sling, bend your elbow.
Okay.
Because it gets stiff. Those are all great things to move because they help with circulation. Just no active motion. If you want to put a shirt on under your sling,
Tomorrow?
just kind of thread it over and then in the good arm.
Okay.
Don't raise your arm, obviously, to put it in there. But once you get that sling off, a lot of people like to have a shirt between them and the sling.
But that's
Okay?
not till tomorrow.
Not till tomorrow. Because
Okay.
right now, you're not going to take the sling off at all today because it's so numb. It'll be like spaghetti. Alrighty. So, no lifting anything with the hand. The heaviest thing is the remote control. Okay?
Or the Kindle.
There you go. So, in 72 hours, she can remove the dressing, take everything off, and then you can shower. Up until then, sponge bathing only. Or you can hose her down outside as long as you bang her the shoulder. I'm just kidding. Since I'm on video, this is my shtick.
No fire hose.
Yes.
This is good because in the 3 hours we're gonna watch it. Like, okay, that's what she said.
Yeah. So again, sponge bathing only until Sunday. Sunday's a great day. Everything comes off. You shower. Obviously, take your sling off in the shower. Do your pendulum exercises, and then go back in the sling.
So other than pendulum and passive motion, I stay in the
Sling,
sling.
correct.
Sleep in the sling.
Correct.
Okay.
Correct. Any questions or problems, his phone number's on this paperwork. You are going to see him in the office in 10 to 14 days.
Okay.
So if you do not have an appointment, call to make one.
Okay.
Or if you have one, obviously follow up when you have it. Any other problems? Severe bleeding coming through on this dressing. Don't panic if you see a little blood shadowing through on the dressing. Sometimes the fluid comes out the scope sites. They use fluid to see in there. It's blood tinged, don't panic. But if it's bright red fresh blood just saturating that dressing, or your fingers are turning blue, and once you've been moving them after the numbing medicine wears off and all of a sudden you can't move them, things are changing for the worse, of course give him a call immediately. With the block, breathing feels weird until it wears off. Throat is scratchy sometimes from the breathing tube. Good. And you will shiver. She keeps thinking she's freezing. It's not that she's temperature cold, but she shivers as her body metabolizes anesthesia. When you get up and you move and then you sit back down, you might be shaking. Very normal.
I have a
That will
Snuggie.
go away. Today you'll feel it.
I'm gonna get right under my Snuggie.
Fair enough.
I'm gonna grab a kitten and a
So,
Snuggie.
all this is for you. As far as your other medications, you can resume them
Okay.
as you tolerate them, okay?
I just want to take an allergy medicine.
You can, absolutely. Excuse me one second.
Yeah.